Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer here at OU Health and the university's Chief COVID Officer. I'm going to give a brief update on where we're at with the pandemic in Oklahoma right now and then just talk about a few issues that are being discussed in the medical news right now. So, for the most part, really happy to be reporting good news. Cases have been coming down in Oklahoma and hospitalizations are down a bit. As of today, Oklahoma ranked 21st in the nation for new cases per day on average. We're down to 46 new cases per 100,000 population. That's about 20 less than we were about a month ago. So that number has consistently come down, and you can see the maps that I provided that show Kentucky, West Virginia, Tennessee, Montana, Wyoming, and Alaska are states that are still being hit fairly hard with the Delta variant right now. If you look at the CDC's data, they report the number of new cases per week. And as of today, Oklahoma ranked 22nd in the nation at 324 cases per 100,000 population in the past week. And again, I've provided the map that shows that Oklahoma's rates have come down substantially over the past few weeks. So we hit another milestone today. More than 600,000 confirmed cases of COVID-19 in Oklahoma. There have been no new deaths reported for the past 2 or 3 days. Over the weekend, as everyone knows, the State Health Department reported and CDC reported 144 new deaths in Oklahoma. And I suspect that number is going to continue to go up. I think it's not long before we will be at more than 10,000 deaths from COVID-19. So when you think about that number,
I'm just going to hold you real quick. We have some people that are late to the party. Apparently their link isn't working, so we're just going to give it about 15 seconds if we can.
okay?
I'm trying to cut you off. Technology, 2 steps forward, 3 steps back.
So do I need to start over, or?
If you could. April said some people weren't able to go in when we were going live. I guess the link is down, but
It's working now.
I mean, it was working fine. I've got it pulled up. I can watch it.
And you can see it?
Yeah. So
Okay.
I don't know if it's us thing or that. I just sent her another link. I hope the
You
same
sent
link.
another link?
No, I sent the same link that I sent you.
Okay. And then what?
We got one showing up.
Okay.
Give me 1 second.
I knew that 3 was blue.
Yeah, really. Normally we're like 15 and waiting.
Okay, she just sent a new link out. Can't you get your handouts and stuff? I can't hear you.
I think it's media thing with us. They look great though.
How many classes are you teaching next semester? Just one, or?
One full class, and then I lecture intermittently on the Norman campus also. I have a few lectures in Norman this semester.
Every time you get on my text, you're warning about breath broken. This cannot happen again. I know.
Sorry about this.
Okay, we're live.
Give me 1 second.
No, she said give it 8 more minutes. She said hold till 1:15. So
Does that girl know how busy I am?
Again, sorry. Don't know what happened. It seemed everything was fine.
or if you want to
Just message it?
yeah, message it to me. That'll be fine.
All right. Bratzler, here we go again.
All right, we're live.
Yes, sir.
All right, hello. Sorry for the delay, a little technical difficulties today. It's probably the most downtime I've had all day today. So I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health and the university's Chief COVID Officer. I'm going to spend a little bit of time talking about where we are at in Oklahoma with the pandemic, highlight the most recent numbers that have come out today, and then I'm going to talk about just a few items that have come up in the medical press this past week for some thought-provoking questions that we need to be asking as we go forward. So as of today, Oklahoma currently ranks 21st in the nation in terms of new cases per day per 100,000 population. We're seeing large outbreaks right now in Alaska, West Virginia, Kentucky, Wyoming, Tennessee, where Delta virus is very rapidly spreading right now. But Oklahoma is definitely past the surge, and we're down to 46 new cases per day per 100,000 population. Similarly, if you look at the CDC's data set, they report the number of new cases per 100,000 population per week, and as of this morning, we ranked 22nd in the nation for new cases per week. So good news overall. Remember, it wasn't that long ago that we were top 10 in the nation with respect to new cases of COVID-19. So today a milestone was hit. We're over 600,000 confirmed cases of COVID-19 in the state, and we're very rapidly approaching 10,000 deaths in the state from COVID-19. There haven't been any new deaths reported by CDC provisional deaths for the past 2 days, but I expect to see that number going up because of the number of people in the intensive care unit with COVID-19. I just want to highlight that when you're at 10,000 deaths in Oklahoma, that means that 1 in every 400 Oklahomans have died of COVID-19. And that's a rate of death that's higher than the national average, which currently sets at about 1 in 500 Americans have died from COVID-19. So it's fairly profound to think about 1 out of every 400 Oklahomans have died from COVID-19. It's a substantial death toll that I don't think any of us ever expected that we would see. 7-day rolling average trend has been coming down. It ticked up just slightly today, but we're below 1,900 new cases a day. And just remember, a few weeks ago, we were at 2,800 new cases a day. So that's a good trend to report also. And when you look at the number of cases per county in the state, clearly now we're following the population center. So Oklahoma County, followed by Tulsa County, followed by Cleveland County, have the most new cases in the state over the past week. And that's the pattern that we saw early in the pandemic when we were dealing primarily with the Alpha variant. Hospitalizations have come down a bit. State Health Department reported 1,235 hospitalizations as of today, with 363 people in the intensive care unit. That number is down a bit. So again, it's the trend that we want to see. I think our hospitals are going to be a bit clogged up for a while, though, just because of the large number of people filling ICU beds. There are still ER hold beds around the city and across the state. But if the cases keep coming down, if we can see cases coming down, then we will start to see hospitalizations coming down. But they will lag behind just new cases. And then finally, the community transmission map from the CDC. Again, you have to see a substantial drop in the number of cases, but right now every county in Oklahoma is still in the red for community transmission of COVID-19. So that's where we set in the state. Some good news. The trends are all downward. I will tell you that at the University of Oklahoma, we've seen the exact same thing amongst our student body, and the number of students that we have that are testing positive has come way down, and the number of students in any form of isolation or quarantine has also dropped dramatically. We're seeing that across the state, which is good news. I just want to highlight a couple of things that have been in the news, some in the medical news, some in the lay press. Again, the death impact of COVID-19 has been profound. 1 in 500 Americans have died. I saw a study yesterday that said if you count up all of the years of life that have been lost from that 650,000 Americans that have died, it's more than 9 million years of life have been lost in our country. It's fairly devastating. So the big news that came out today was that we're hitting somewhere around 1,900 deaths a day in the United States, which is high as we were last March. And again, case counts for COVID-19 are starting to fall across the entire nation, which is good. But deaths will lag, and we're going to see continued death rates that are high for some time to come. And the other thing that came out is studies that have been done now that have looked at comparing vaccination rates for states that have the highest, comparing death rates in the states that have the highest vaccination rate versus the states that have the lowest vaccination rate. So basically the researchers looked at the 10 top states for vaccine and the 10 lowest states for vaccine, and the death rate in low vaccination states is 4 times higher than it is in those states that have high vaccination rates. Oklahoma was not in either of those cohorts. We were in the middle in terms of the death rate. A couple of other things that came out this week. There's been obviously a lot of talk about booster doses, and Pfizer has presented their data to the FDA seeking approval to give booster doses. And as everybody knows, the FDA advisory panel recommended that the elderly, immunosuppressed, healthcare workers, perhaps teachers, and also people with high-risk conditions be eligible for a booster dose. Johnson & Johnson just yesterday released data in a press release that has been sent the data to the Centers for Disease Control. They did a real-world study of 1.5 million people who were unvaccinated, compared to 390,000 people that received the Johnson & Johnson vaccine. And the gist of their report was that the vaccine remains effective at preventing the most important things: hospitalization, complications, and death. They did show that vaccine efficacy was higher in younger individuals. We've seen the same thing with Pfizer and Moderna. Older people seem to have waning immunity quicker, or maybe more susceptible to the complications of COVID-19. So Johnson & Johnson showed the exact same thing, that efficacy was 83% in those that were under 50, and it was also lower than in people who were immunocompromised and the elderly. So again, seeing this fairly consistently with all 3 vaccines, that the longer you get from your second dose, particularly in the elderly, you probably will have some lagging vaccine efficacy, and that's why there's all of the discussion currently about boosters. Johnson & Johnson also presented booster data, and they showed that if you waited 2 months after Johnson & Johnson and repeated the dose, you got a 4 to 6 time increase in your antibody levels against COVID-19. But they showed that if you gave your first dose and then waited and took your second dose 6 months later, they got up to a 12-fold increase in antibody levels by waiting 6 months. And that has raised a substantial medical debate that's going on right now about, are we giving second doses of vaccines too soon? So remember, for Pfizer vaccine, you get your second dose 3 weeks later. For Moderna, you got it 4 weeks later. A study that I highlighted in one of our previous press briefings looked at Moderna versus Pfizer and showed that people who got the Moderna vaccine had twice as high of antibody levels, and there were 2 reasons that were suggested. One was you get a bigger dose with Moderna, so you're getting more RNA, so perhaps that's part of it. But the second thing is you have an extra week between the 2 doses, and does that stimulate your immune system more? And in fact, remember that the UK, when they first started rolling out COVID vaccines, they elected to give first doses only, so they could get as many people 1 dose as possible, and then subsequently gave second doses at a later point in time. So the big debate right now is, what is the appropriate interval between a first and second dose of the RNA vaccines? Are we giving them too close together? Some people have suggested that giving them within 3 or 4 weeks of each other is just acting like a bigger priming dose, but not really boosting the immune system. And there are studies that suggest that. I highlighted one study in the handout from the University of Birmingham that showed that if you delayed the second dose of Pfizer by 12 weeks, older people got a much, much higher antibody response to that second dose than they did if it was given at 3 weeks. So remember, when the companies did their studies, Pfizer and Moderna in particular, they were trying to get a vaccine ready in a hurry. The technology, the RNA technology, had been around for many years, but now they needed to test it against COVID. And so, because we were in a crisis, they were enrolling patients in those clinical studies as quickly as they could. They didn't take any shortcuts, But one thing that they elected to do was to give the second dose at a short interval after the first dose. We really don't know whether or not there might be a reason, a good reason, to delay the time between first and second doses that might actually boost the immune system even more, because that wasn't studied. That was not the purpose of the initial clinical trials. So, as one of the authors said, there's a growing body of evidence over the last several months that has shown that a longer interval provides better immunity in the long term. And it might even eliminate the need for a booster. If you waited 6 months between the two doses, then you might not need a booster at all. Finally, I think I just wanted to highlight, lots of good news right now. Cases are down, hospitalizations seem to be creeping down in Oklahoma. U.S. numbers are coming down. Deaths are high, but they lag behind the number of cases. But the one thing I still worry about, in fact, I saw a news report this morning that suggests that some of the models that CDC has says that maybe we won't see a big surge in cases this winter, and it might be several months even into the spring before we see a surge in cases. But there's one thing that could screw that up, and that's variants. If we see another variant that behaves like the Delta variant and comes in and infects a lot of people, and your previous infection or your previous vaccine doesn't protect you, we could potentially be going through all of this again. So I highlighted the data from the weekly epidemiologic report that the state health department prepares. We've seen 45 cases of Lambda variant in the state and 15 cases of the Mu variant. So both are variants of concern that we want to watch very carefully to make sure that we don't see those take over as Delta wanes. But the second one, there was a new variant that just was reported in Kentucky. This variant was first identified in Japan. Of course, we just sent all the Olympic athletes, staff, and trainers to Japan and brought them back. But in Kentucky, they had a skilled nursing facility. There were 83 residents and 116 healthcare workers, and of those, 26 patients and 20 workers tested positive, and all of them tested positive for the new R1 variant, R.1. 25% of the vaccinated residents who got infected were fully vaccinated. 7% of the staff who got infected were fully vaccinated. One of the infected patients died of the disease that was fully vaccinated. So again, it's another variant, and it's the one thing I think that could set us back if we see one of these variants take over where Delta leaves off right now. So that's where we're at right now in Oklahoma, and some of the concerns that I have in the news, the medical press in general. I want to make sure everybody understands that I'm quite pleased with the numbers in Oklahoma, but we can't let our vigilance down yet because it's still spreading out there. Just under 2,000 people a day in Oklahoma are still getting COVID-19.
I leads right into the first question. Does the fact that more people have died in Oklahoma than during the Spanish flu pandemic of 1918, will that help convince people to become vaccinated, those remaining who still are resistant to that?
It's a great question. The number of deaths, 1 in 400 Oklahomans have died of this disease. Will that help convince some who are vaccine hesitant? I don't know. I find that people who know somebody, particularly if it's a family member that get infected, have severe complications, hospitalization, and even death. Sometimes those people do begin to, they realize how serious this is. But we've known, 650,000 Americans have died of this disease. Third leading cause of death in the country, a preventable disease, and still people aren't getting the vaccine. It's a little bit hard to explain, but I'm not sure that the death statistics are enough to convince people.
You and I have spoken before about the politicalization of the disease in its early stages and the resistance to vaccination based upon that. What do you think it would take to convince people that this is not some kind of political stunt or whatever to take their freedoms away or restrict them or whatever? What would it take to
I guess, so the question is, how do we move beyond the politics of the vaccine and the virus and the disease And I don't know the best answer. I just would simply say that we need to treat this as a public health problem, not a policy problem or a political issue. It's just a virus. It's like measles, smallpox, polio. It's a virus that spreads easily from one person to another. It doesn't care what your color is, what your race is, what your religion is, what your political affiliation. It doesn't care. It just infects people, and in some people, they get very, very sick and they die of the disease. I would argue that most of the people who argue against the vaccines, many of them were vaccinated as kids because their parents took them to the doctor or stood in line like my dad did to get, to beat polio by chewing up, vaccine in a sugar cube. They did it because they saw the devastating consequences of the disease. Here we have a disease that's the third leading cause of death in the nation. It is a preventable disease. Many insurance companies now consider it preventable, so they don't waive co-pays and deductibles and other things. People need to see that this isn't about any particular politics. It's just simply a virus that's behaving like viruses do.
Yesterday, the Thunder came out with an announcement that they're going to require proof of vaccination or a negative test to attend their games this year. Do you think that will be an influence in people going forward wanting to be vaccinated so they can go to events like that?
Yeah, so the question is about the Thunder, their press release yesterday that to go to at least the first 12 games of the season, that you either have to show proof of vaccination or a negative test within 72 hours. Not required to get the vaccine, but you do need to bring results of a negative test. Will it help slow the spread of the disease? Well, first I want to point out there are lots of events in Oklahoma right now that have the exact same requirements. I believe Garth Brooks is getting ready to come in, and if you want to go see Garth Brooks, you have to show proof of vaccination or a negative test to go. Many of the other organizations like the Memorial Marathon, it's a requirement. Why is it? It's a requirement to run in Boston. It's a requirement to run in Chicago. So it's to try to protect the people that are participating in these events. I did some calculations just to see, how many people might be inside of Paycom Arena if, we just open it up and nobody's wearing a mask. What are the risks? And the arena, as I understand it, holds just a little over 18,000 people. And if you look at the number of people in Oklahoma who are currently considered infected, there would be no fewer than 71 people in the arena spread around that are infected that could spread the disease to other people. But if more likely, there are a lot more people in the community who are infected that just never got a test done who can spread the disease. There could be several hundred people in the arena that are actively infected. So when you're sitting in the stands and you have people behind you, and certainly people at a Thunder game typically aren't quiet, they're going to be yelling for the team and other things. Do you put yourself at risk? And I think it's a bit different being indoors at a basketball game where you're in an indoor setting versus sitting outside where the wind can dissipate the air around you and things like that. So I've heard all the comparisons between football and basketball. We've generally considered indoor sports, indoor activities and gymnasiums to be higher risk because there's less airflow in the crowd itself. So will it help? Sure. And the Thunder were right up front when they put out their press release that they're going to watch the numbers in Oklahoma very carefully. If they keep coming down, then they may modify their policy.
Can you speak to this is kind of going back to the people who are hesitant and are doing things, whether it's ivermectin or gargling with iodine, believing that prevents COVID. Potential dangers of all of that, and as opposed to taking the vaccine.
Well, clearly the vaccines, I think we've talked about before, are incredibly safe. So if you look at the studies that have been recently published looking at the RNA vaccines in more than 6 million people in the U.S., 11 million doses of vaccine, in fact, they didn't find a single side effect that occurred with the vaccines more commonly than it occurs in the general population. So incredibly safe, some of the safest we've ever had in terms of vaccines. So the vaccines are safe. They're also very effective. Yes, we're all hearing a lot about breakthrough infections. They definitely occur. But if you get vaccinated, your risk of being hospitalized and dying from the disease is dramatically reduced. It's not zero, but it's dramatically reduced. So here's a proven therapy that can substantially reduce the risk of the complications of the disease, and yet people are out there seeking things that are completely unproven, like ivermectin. The most recent one is the povidone iodine or betadine type gargles or slushes or nasal sprays. There are studies looking at all of that simply show that they don't prevent you from getting COVID, and they don't necessarily prevent you from spreading COVID, and they certainly don't treat it.
While we're on that topic of some of the alternatives, can you discuss Generon and whether it can be used prophylactically and how long its benefits might last?
Yeah, so the question is about monoclonal antibodies. So Regeneron Covey is one of the brands that's available. And in the clinical studies, it is recommended now for both treatment of a person that's an outpatient. So if you were to get infected and you had risk factors for complications of COVID, then I would recommend that you go get monoclonal antibodies as soon as possible, because in the studies of monoclonal antibodies, they've reduced the risk of serious COVID disease by 70 to 75%. Again, proven therapy. Now with Regeneron, we now have an indication to give it post-exposure prophylaxis. So let's say, your spouse tells you that I tested positive today. You've been living with your spouse, you've been directly exposed, and particularly if you have risk factors for severe COVID disease like obesity, diabetes, lung disease, heart disease, those types of things, we can go ahead and give you now monoclonal antibodies prophylactically, even if your test is still negative, because in the studies, giving it prophylactically reduced the risk of severe COVID disease by 76%. So again, monoclonal antibodies are incredibly effective when given early to people, usually as an outpatient, before they're sick enough to be in the hospital. Incredibly effective at reducing the complications of the disease.
Kind of shifting gears here, talking about specific age groups now. The 18 to 35 age group, is there a concern that they might strain or overtax the hospital system?
Well, so the question is, are younger people going to strain or tax the hospital system? So we have seen younger people come into the hospital, particularly with the Delta surge. But if you look overall, even with the Delta surge, age is still the biggest predictor of hospitalization and death. So 18 to 35-year-olds and younger, kids, we're seeing kids with COVID that come into the hospital. Absolutely. But when you look at the overall numbers, they're still relatively low as compared to the elderly. The elderly are clearly at the greatest risk of the complications of this disease. So I don't expect them to overtax the hospital system. I remember when I was 18 years of age, I was invincible. And that's kind of the attitude I see for a lot of younger people, that they don't see COVID as a real threat to them. They see it as more of a minor illness. And luckily for most, it is. But sometimes it's not. It's much more severe.
Are there any specific challenges to age groups like this when it comes to convincing them to take the shot?
Yeah, so the question is it harder to convince them that they need the shot? And again, I think it comes down to when you're young, you don't see risk of severe disease as a common thing in your future. So a lot of younger people have been reluctant to get the vaccine, they just don't quite see the need to protect themselves against the disease, even though their parents very, very likely signed them up and got them childhood immunizations before they went to school, because they couldn't go to school without it, and because their parents wanted to prevent them from getting other diseases. So part of it's just pure education. I have to tell you that on the university campus, we've seen a lot of our undergraduates getting vaccinated. The vaccination rates were higher than we expected coming in to the university, and I think with proper education, they do understand the need to get vaccinated and are doing so.
You talked about the Thunder and concerts like Garth Brooks. Do you think those types of events and the requirements to attend will provide an incentive for the younger age groups?
Yeah, so the question is, will some of these efforts by requiring proof of vaccination or otherwise having to get a negative test, will it help incentivize people to get vaccinated? Maybe some. I don't know how big of an impact it'll have, but in my opinion, the more people we get vaccinated, the more likely we are to get back to kind of life that we knew before COVID.
Is there any data that shows let me rephrase it. Is there currently data that shows how people are not getting vaccinated because they've had COVID and now they consider themselves immune?
Yeah, so the question is, somebody's had COVID-19, so they don't think they need to get vaccinated because they already have some degree of immunity. And so, two quick ways to answer that. First, they do have some evidence that they do have some immunity. But I've highlighted in one of our press briefings before, there was a very good study out of Kentucky that looked at people who had had COVID-19. So the only people in the study had already had COVID-19. But then some people got vaccinated and some people did not. And they compared those two groups. The people who had had COVID before who did not get vaccinated were 2.3 times more likely to be reinfected with COVID than people who had had COVID and got vaccinated. Giving the vaccine after you've had COVID is a very substantial boost to your immune system. So we strongly recommend that anybody who's had COVID get the vaccine also.
When do you think we might see a really big drop in hospitalizations?
Well, I actually think the hospitalization rate's going to come down slowly. Case counts are coming down slowly. Hospitalization rates tend to lag behind that. So I don't expect to see them just drop off suddenly, but I'm hoping over the next couple of months that we just see continued steady decline in the number of people that are being in the hospital because of COVID-19.
I know we do a press release a couple of times a week on this, but what's the current bed situation, and is there a shortage of ECMO beds?
Well, so the first question is there a shortage of beds? Yes, the hospitals in the metro are still very full. I think all of the hospitals still have some patients that are in what we call emergency department hold. They may or may not be COVID patients, but because there's a lack of beds or ICU beds in particular, they may have to hold in the emergency department until a bed can be opened up. But remember, we've talked about this many times before, it's not necessarily physical beds. It's staffing, nursing to actually open those beds. And that's the problem with ECMO. As Dr. Ryan Kennedy pointed out in one of our previous press briefings, we have ECMO machines, but they require one-on-one nursing. And over a period of a shift, a day, it may take 4 or 5 nurses over the day just to take care of that one patient that's on ECMO. So in an era where you have markedly limited staffing in our hospitals, it limits the ability to offer ECMO to more patients because it just very intense nursing care.
Yesterday during their weekly briefing, the Oklahoma Health Group, there was a number that was put out that approximately 78% of Oklahomans now have some type of immunity. Is that a pretty good number?
Yeah, so I think so. So I think that was probably Dr. Wendelboe that put that out in the Healthier Oklahoma Coalition press briefing. You know, we estimate, again, that when you look at the numbers of people who have been infected in Oklahoma, let's say right now we're very, very close to 600,000 cases in our state. Let's say that for every one person that had a test done that was positive, there are 3 people in the community that got infected. So that would be 2.4 million people in our state when you multiply 600,000 times 4, 2.4 million people that may have been infected with COVID at some point, plus all the people who've been vaccinated on top of that who haven't had COVID. So, our 80% have some level of immunity that's possible. Delta variant spread very rapidly through unvaccinated people, and those are the people that ended up in the hospital. And because of that, Delta, I think, is starting to burn itself out, and that's why we're seeing the curve drop, because it's having more and more trouble finding new people to infect.
And final question, and it's probably the one that most everybody is most concerned about or most cares about. When do you think we'll see the next surge?
Yeah, when will I see the next surge again? I heard the report from CDC this morning that their group of data analysts suggested that it might be early spring, say February, March, April, in that range. I honestly don't know. I think the one huge unknown, though, is will we see a different variant that pops up that becomes highly contagious, particularly in the winter months. So that may be the wild card. But I think Delta will continue to see those cases trail off now.
Anything we haven't covered that you'd like to add?
Can't think of anything new. Wear your mask when you're indoors.